guys, welcome back to Empowerin'. I'm Carolyn Porter-Thomas. Thank you so much for watching. So I have a video request that was requested by two different people, and I'm going to read you their request. The first one was by Kelsogood78, who said, I love your videos. I was hoping you can do a video on how to deal with death and dying as a nurse. The next video request was from Nikki who said, can you do a video on how nurses deal with death or dying patients? I used to work on an oncology unit and I can't seem to deal with my patient's death. That's one of the reasons why I quit nursing before. I still feel like it is one of the greatest challenges for me. So the first thing that I want to say is that having a patient die is something that I, as a nurse, I still fear to this day. I've been practicing as a nurse for 6 years, and thankfully I've only had maybe a handful of patients die on my shift or under my care. It's still something that I feel like never really gets easier. I feel like no patient's death is ever the same, and there's different ways that I deal with things, and maybe they would help. Before I tell you the things that helped me, I want to tell you about the first experience that I had when I had a patient that died, my first patient that died under my care. Basically, I'd only been a nurse for about 6 months, and the patient was he was much older. He was like 89, I think he was in his early 90s, and he did have a terminal disease. And he was actually very confused. He was not able to communicate, and I wasn't really able to build a relationship with that patient. But what made this patient's death so hard was that his wife was the cutest little lady that I had ever seen in my entire life, and she took such good care of him. And I really built a relationship with her. I had the patient, this was going to be my second night in a row. I could just see that she was so tired. She was contemplating on whether she should go home and get some rest or if she should stay the night. We talked for a little while, and after a while I just kind of said, you know, you really need some rest. There's not really much you can do here. Why don't you just go home and get some rest? I've regretted saying that, you know, since I said that, but that night around 2 a.m. I got a call from the telemetry technician that said, hey, your patient's heart rate's been in the 80s all night and now it's dropping. It dropped to 60, now it's dropping to 40. And then as I was on the phone, I was getting up and I was running to the room, and she was like, oh my gosh, it's in the 30s. And when I got there, he did not look good. So anyways, I called a code right away, and we lost him that night. It was just the hardest thing, seeing his wife walk in and seeing him. She was a woman that was a very, very strong woman. She knew that this day was coming, and she sat down with me and she shed a few tears, and I shed a lot of tears. I think I cried a lot more than she did. You know, we were able to comfort each other, and, you know, she helped me realize that this was a long time coming, that this was meant to be, and not by what she was saying to me, but by her actions. Like, she was just a very, very strong woman. And so thankfully, you know, I have to say it was a good experience. She showed me a lot of true strength that I don't see in everyone, and I hope to exemplify when I'm faced in similar situations. Having practiced nursing for 6 years, and since I float from unit to unit and hospital to hospital, I have realized that, there is no patient's death that would ever be the same. However, there are units where you will see a greater amount of patients dying, and the units are different. For example, Nikki, you are working in an oncology unit. When I float to an oncology unit, I'm very surprised to hear that it's part of the report on which patients died. A lot of patients that are hospitalized for cancer were sent there by their oncologist, and they're unstable. So not every cancer patient is hospitalized, but the ones that do come to the hospital are usually very unstable. So on a unit like that, you would kind of expect to see a lot more patients die. But it's not every unit. There are units that you would see a greater amount of deaths, and that would be the emergency department. But at the emergency department, you have a lot of patients that are coming in. Many of them have already died, but maybe through the efforts of the fire rescue, they were able to resuscitate the patient and get a pulse, but maybe that pulse won't last. So you get patients and you have no relationship with them. You haven't built rapport, and they come and they've basically already died. So it's a different type of experience. Now, of course, there could be traumatic deaths, like if you work in a hospital that has a trauma unit, and you see a lot of young people come in from car accidents. Now, me personally, I don't work a trauma unit because I don't think that I could handle that. But there's a lot of people that can, and that they love it, and they really love, and they really feel like they make a huge difference in people's lives. Obviously, they are practicing nursing, highest level of acute care, and to them, that's what they love. And if that's what you love, then that's totally okay. For me, I like nursing to be more of like a comforting thing. I like the service aspect of it. So if you're like me and you want a relationship with patients, you want to help patients feel better, you know that a patient may die at any time, and that's something that we all have to accept, but you don't know if this is something that you want to deal with all the time, then I would encourage you to maybe work in a specialty like mine, which is telemetry or med-surg, because most of your patients on those units are very, very stable. And if they become unstable, then you usually transfer them to a higher level of care, such as an intensive care unit. Like I said, I've been a nurse for 6 years, and I've only really had a handful of patients die on my shift. Most of the time, if I see a patient's unstable, I call the doctor and say, I have 6 patients here, or I have 7 patients here. I cannot give them the focused attention that they need. Can we transfer them to a unit where they have 2 to 3 patients? When a patient actually does pass, basically your focus goes from obviously the patient to the family. And I just want to encourage you guys that it is okay to sit down with your patients' families. I've sat down with a number of my patients' wives who have died. Haven't had an experience where I've sat down with a husband, but I do remember sitting down with a patient's wife, and I sat down with her for 30 minutes, and she told me how they'd been married for over 40 years, and she told me some of the things that they had done in their life, and we cried together, and we even laughed a little bit together because he had been such an amazing person. So I want to encourage you to be okay with however you react. If you cry a little bit, it's okay. If you get a little bit down, it's okay. Like, it happens to us all. So here are 3 things that have helped me deal with my patients passing. And the first one is I forgive myself. Many times when we have a patient that dies on our shift, we kind of may blame ourselves. We may think that we should have caught something, or we think that we missed something, or we should have noticed things earlier. And especially with my first patient that died, I really felt like I should have noticed cues, but I had only been a nurse for 6 months. I really didn't, know the cues to look at. But I mean, looking back, there are probably things that I could have noticed. But ultimately, you just have to forgive yourself. What's done is done, and just realize that you did the best you could. The second thing that I do is I push myself to become better. So I want to learn the hard lessons that need to be learned. So what could I have noticed earlier? What could I have done earlier? Maybe there is something that I could have done. Maybe there was something that I missed that didn't need to be missed. So I just focus on becoming better so that I can become a better nurse and care better for the patients that I will have the pleasure of caring for in the future. The last thing that I do is I really become very grateful. It's not every profession, it's not every job where we get to experience situations like this. And it really helps me not take any moment with anybody for granted. I know that we are not guaranteed another second, another minute, another day, another week, another month, because I've seen people's time end at that second. And when you see a time of death actually verbalized, you're like, wow, one day that's going to be me. So how can I make my time matter? How can I make the people that I have the pleasure of interacting with in life, how can I make my impact with them matter? How can I enjoy the relationships that I'm gifted to have? So ultimately, I use it as a way to become incredibly grateful for every experience that I do have with the wonderful people that I do have the pleasure of experiencing life with. So guys, I really hope that you enjoyed this video. If you did, please give it a thumbs up. And if you do have any video requests, or if you do have any other advice to share, if you're an experienced nurse or a nursing assistant, or if you've experienced people passing before and you have some advice to share with other potential nurses or nursing students, please post a comment and let us know. I'd love to hear from you guys. All right, I love you. I can't wait to see you soon. And all right, bye.